Case 35. A 49-year-old man presents to the emergency department after a syncopal episode. He denies any chronic health problems and states that he stays fit by walking several miles through the local park every day. Physical examination shows bradycardia and a 12-lead ECG is ordered. On review of systems, the patient states that he has had low-grade fevers over the past few days and an area of induration in his left groin surrounded by an erythematous ring. Induration is sclerosis or hardening. What is the most likely diagnosis? Third degree atrioventricular or AV block secondary to Lyme disease. This condition is caused by Borrelia burgdorferi, a gram-negative spirochete that is poorly grown in culture and too small to be seen under regular light microscopy. Fluorescence may be used to visualize the corkscrew-shaped bacterium. However, the diagnosis is usually made clinically, supported by serology. Early local infection may present with a bull's-eye rash, erythema chronica migrans after several days. The early disseminated stage may develop as early as a few days later and presents with cardiac conduction abnormalities called Lyme carditis, cranial nerve palsies, especially cranial nerve 7, and meningitis. Up to 43% of patients with Lyme carditis develop complete heart block. What other conditions can cause this condition? Damage to the heart's conduction system by fibrosis, ischemia, cardiomyopathy, myocarditis, or iatrogenic damage. Iatrogenic means caused by medical examination or treatment, e.g. after valve replacement, and may cause complete heart block. Digitalis, calcium channel blockers, and beta blockers may produce a temporary conduction abnormality. What is the route of infection? Lyme disease is an arthropod-borne infection. The Ixodes tick transmits Borrelia burgdorferi. Mice and deer are reservoirs for the disease. What is the prognosis for this patient? The prognosis is good. The conduction abnormalities secondary to Lyme carditis are self-limited and short-lived and often resolve within days to weeks. It is uncommon for residual conduction abnormalities to persist after the infection has cleared. What is the appropriate treatment for this patient? The patient's ECG demonstrates bradycardia at a rate of 40 per minute. The episode of syncope indicates that cerebral perfusion is inadequate at this heart rate. Consequently, transvenous placing may be initiated, but a permanent pacemaker is not needed. Antibiotic treatment for Lyme carditis consists of intravenous ceftriaxone until the PR interval is less than 300 milliseconds, at which point oral antibiotics may be initiated. The same regimen applies to Lyme disease with neurological features. Doxycycline or amoxicillin is used for primary infection and Lyme arthritis only.